Is it safe to prescribe antipsychotics to people with dementia? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot about the importance of providing full informed consent, as well as safety prescribing on this app. And I've been going through a series where each day I go through one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And one of the things that has come up multiple times is, what about the use of antipsychotics in older people, especially those with dementia? Because there is a black box warning against the use of antipsychotic medications in people with dementia. The reason is because there is an increased risk of mortality, meaning death, with the use of these medications in this population. So obviously there are some significant concerns about using these types of medications in people with dementia. So why would we use them? Well, in this population, there comes a point when we think more about quality of life than quantity. And so for those individuals who are really suffering from their dementia, particularly having behavioral disturbances, like they're wandering out, they're getting aggressive, they're harming themselves, sometimes these medications can be helpful for those symptoms. And so even though ultimately there's a chance that they could decrease the time that they have left, the idea is that they may improve the quality of their life. And what about, is atypical versus an atypical antipsychotic better, meaning like the first versus second generations? Well, it's kind of, they each have their issues. So with the typical antipsychotics, these are more likely to worsen Parkinsonian symptoms in older folks. So that would look like slowed gait, mass facies, tremor, muscle rigidity. Whereas the atypical antipsychotics, they have effects on a lot of different neurotransmitters, so serotonin, histamine, things like that. And so these can contribute to things like altered mental status. So they could be contributing to a delirium on top of the dementia that someone's already experiencing. So it really depends on the individual. The best thing to do is to only use these medications for a finite period of time during a behavioral or psychiatric decompensation, and to taper off that medication once it's no longer acutely needed. I also may use this medication just as needed so that mitigates some of the risks, but it also gives them a tool for if something's going on. But there are cases where I've tried to take these medications off of someone's regimen and they just continue to have behavioral disturbances. And at this point, that's when we're having a goals of conversation discussion and talking about, does this person need additional resources, maybe living in a facility, that kind of thing. So it's not an easy topic, but it is an important one, and a decision that I'm always going to make using shared decision making, ideally with both the patient and their caregiver. But of course, there may come a time when it's primarily their caregiver. Wishing you all good mental health, and I'll see you in the next one.